Thank you. Good evening, Mayor and City Council. This is Mary Rose Corrigan, Public Health Specialist with the City of Dubuque Health Services Department with a latest update here on COVID-19. Up on the screen, I brought up the Iowa Department of Public Health main page for their COVID-19 information, and it's one that I refer to regularly, and it's a good resource for everybody to know exactly where the state is in terms of cases and where they're at. As you can see, Dubuque is highlighted, and we have 6 cases. This was updated today. I will tell you that this site in particular is not updated at any consistent time during the day, and for the most part, it is usually in sync with the governor's daily media conferences at 2:30. There's often a media release that goes out before her press conference saying the new cases. So it is updated for sure by the end of the day. And if you scroll along here, you can see the individual counties and their number of cases. If you scroll further down the page, you can see the demographics of the patients we have in Iowa. In Dubuque County, with our 6 cases, we are following similarly in those categories. One of our cases is in the 18 to 40 age group, 3 are in the 41 to 60 age group, and 2 are in the 61 to 80 age group. So that's pretty much mirroring what the state is seeing in terms of demographics. We, at this time, are not getting detailed information on how the individuals acquired their infection. I'm sure as the state epidemiologists are gathering that information into our regular communicable disease system, they'll be able to produce some more detailed reports on methods of exposure. But that probably will take them some time to pull together. But right now they're prioritizing on keeping all of us informed of the number of cases. The other thing, if you view on the full screen version here, it pulls up the map in a bigger format, a little easier to see. I would also call to your attention all the resources on the side of the page here under COVID-19. They have categorized it into a lot of different sectors. For instance, business and organization has various resources, some specific to businesses such as the food industry, the livestock industry, social distancing guidance. And under the public section, there is the isolation guidelines spelled out. Please, when you are viewing these, when you open them up, they are all dated. And that's very important. For instance, this one was updated yesterday. That is very important because these guidelines are changing regularly. And so it's important that if you print off a guideline or refer to it, that in a day or two it may change. So just be aware. And that changing of those guidelines is based on the state and the whole country, for that matter, finding out ongoing new information about cases and spread and how all that occurs. So this is one of those things where, you know, we say, yeah, these things are going to change. So just be prepared for that. With the cases in Dubuque County, a couple related things. The new guidance that the governor put out yesterday does call for specific recommendations if you've traveled outside Iowa. And this is especially timely considering that there's quite a few residents returning from spring break trips. And so the isolation guidelines for those traveling outside of the state take away a lot of the question of, well, were you in a high-risk area or not? We're really recommending if you were traveling anywhere, either within the United States or internationally, that you follow the 2-week isolation guidelines as a precaution, whether you're ill or not. And these guidelines are spelled out here on these websites. It's very helpful to read through them. It gives guidelines for if you're well or you're sick. And there are special guidelines for what we refer to as essential services personnel. And those include people like police and firefighters, healthcare workers, and even those essential to community response, like that are part of the incident command team and the community response as a whole. So there are some special provisions. But as the mayor stated, the intent of these guidelines is to slow the spread and not have a big spike in our incidence curve. So let's not try and get around these guidelines or find loopholes in them as a way to be able to move around the community more. The basic message is stay home, and if you have to go out, only do it for essential services and in direct trips. I can't stress that enough. In addition to the travel guidelines, the governor did update the closures of businesses to include things like salons, beauty shops, spas, barber shops, tanning booths, tattoo parlors, and swimming pools. So those places all fall into the same category as the restaurants and the bars and the schools. So regarding some of the isolation recommendations, refer to the fact that if you are mildly ill and can take care of your symptoms at home, that you do not need to be tested for COVID-19, because we will assume that you are positive. And people are asking me, well, why wouldn't you want to know for sure? Well, there's a couple reasons. One is because the outcome is the same. Regardless if you're positive or not, you need to stay home for that recommended period of time and wait till you're fever-free for 72 hours, symptom-free, and then symptom-free for 7 days from the onset of your illness. Those guidelines are the same, regardless if you're positive or not. The other thing is we have such limited tests right now, and we have to use them on the people that really need them, the people who may potentially be hospitalized. And finally, another thing to consider is that when a healthcare provider takes a specimen from you or a swab for your testing, they have to be fully garbed in personal protective equipment. And this uses up our personal protective equipment, or our PPE, which we all are coming to realize is a precious commodity right now. And so we don't want to waste it on unnecessary testing. Iowa will continue to get more tests, both through the state hygienic lab, and also the private reference labs are starting to supply various healthcare entities around the state. So as those come in, our community will see based on the testing recommendations, and likewise we'll likely see more positives. That I can pretty much guarantee is going to continue. Let's see here. Regarding ill people or positive cases in our community, first of all, I want to stress that people are most contagious when they are symptomatic, when they have the cough and the fever. There's a lot of research happening around the world about when this virus is the most communicable to others, how many days before symptoms show up, is it contagious? And as symptoms subside, how long are you contagious? There's no clear-cut answers on some of those questions yet. But we do know that you are most contagious when you're exhibiting those symptoms. Regarding our local follow-up of positive COVID-19 residents, the Dubuque Visiting Nurse Association public health nurses continue to do that contact tracing and follow-up, and that's based on specific guidelines from the Iowa Department of Public Health. We want to remind everyone that if you have an exposure to COVID-19, the VNA nurses will be contacting you and giving you direction. If you do not get contacted by the VNA and you have concerns that you are exposed, then you should self-isolate. They are using a number of mechanisms to expose both close contacts and people further out of the cases circle. So you may hear directly, you will hear directly from the VNA nurse if you need to follow specific instructions. The state health department is no longer giving public health orders for individuals. This is becoming more like our usual communicable disease follow-up. Those will only be issued in extreme cases where isolation is not occurring cooperatively. So while the VNA continues to have the community call-in center for general questions about COVID-19, we encourage people to keep calling. But if you're calling specifically that you think you need to be contacted because you're exposed, we ask not to do that because it is using up our communicable disease nurses' time talking to potential exposures when that isn't really even necessary. The VNA is going to be staffed for making these contacts 24/7 in case something comes in after hours. They've already been working on the weekends, of course, but they will have on-call staff able to address anything that comes up in the after hours. And they are working every day to make those contacts to those people that were exposed. Finally, I want to let everyone know that our public health incident management team continues to receive regular quality updates from the Iowa Department of Public Health. We had an hour-and-a-half long meeting yesterday. And when we need their specific assistance and technical help, they work directly with us. I also want everyone to know that our team is not attempting to solve all these problems ourselves. We are using a lot of other folks, both within the incident management system and outside, including, of course, the city and county staff who are working on specific objectives and problems. But we're also giving specific tasks to certain parts of the healthcare community. The business community is stepping up to do research for us on specific situations and requests. The nonprofit community is working together on funding and providing services. So there are a lot of other sectors in the community working on this response. And we do not hesitate to reach out to these organizations when we need help and or expertise in these areas. So, and also we want to avoid duplication as much as possible. So all the community partners need to be commended for the work they're doing. They're all working very hard on the community's behalf. So that ends my prepared report. I'd be happy to answer any questions you have now regarding the COVID-19 response situation.
Okay, and if anyone has any questions for Mary Rose, please identify yourself so that everyone knows who is on the line. Or I can go, I guess I'm supposed to go down the list. Mr. Kavanaugh, do you have any questions?
Yeah, thank you, Mr. Mayor. I do have one, just quick one. First of all, thank you so much, Mary Rose, and everybody who's working so hard on this. I don't know if we're going to be able to thank you all enough for the very hard work that you're and time you're putting into everything. So I very much appreciate your specific, direct reports to us and to the community. My one question has to do with something that seems so simple, but it's, you know, the fact that we have to eat. We need some very specific essential items in our life, but that also means that we need to gather in groups. So I was wondering, from a medical perspective, if you could offer to us and to the public any guidance for when we go to the grocery store, to the drugstore to get medication, or visit the various drive-up food pantries that are stepping up to help with families that have food insecurity. How should we conduct ourselves there? Should we be going as a family? Because I'm understanding that's still happening. You know, what are some of the things that you would recommend in that case?
Well, in all cases, if you know, one individual can do the errand running or food pickup from a household, that is preferred. We understand that sometimes parents may have to take a child in tow to avoid a child care situation. But when people are in those situations, several of them, you mentioned, Mr. Kavanaugh, you can call ahead. So the food pickup thing, even the food pantries and meal distribution centers they have everything packaged up, which is very helpful in minimal contact. But when you're at these places, we really have to think. You know, our culture is so into, if we see somebody we know, we shake their hand, or we give them a hug, or we may touch them in some way, or we get close to them. And it's just part of the way we live our lives, and that's the way our socialization is. So we have to be cognizant of those and not be afraid that we're offending someone if we don't shake their hand, or if we keep our 6-foot distance. If most of us spread our arms out between each other, that's a good indication. It is hard at first, and even in coworker situations when we can't gather in a room with 5 or 6 of us like we always used to. And we just have to remember distance is going to greatly help in the transmission. There's a lot of new studies working on how the virus is both spread droplet and aerolized, and what happens to it when it comes out of a person's mouth and the distance it can go. And that's why we have those specific distance guidelines, you know, for the 6 feet. So those need to be followed even when you're doing these pickup things. Sometimes the grocery store issue, you know, may be a little bit more challenging. Try and, you know, not go during the busy times. I'm not sure when that is these days. But the other thing, we don't need to all do a rush on the grocery stores. The food stores have kind of put the message out that their supplies are going to continue, and there are not going to be unnecessary shortages for the weeks to come. So I think it's just a conscious effort, not being afraid that we may potentially be offending someone, stopping and thinking, practicing the elbow handshake or whatever, and just keeping your distance.
Okay, Mr. Resnick, any questions?
Yes, one question, please. Mr. Mayor, with your guidelines, does this mean that we are not able to really support our local restaurants with carry-out food? I noticed that you said food was essential. What do you feel about, I've been going to local restaurants almost every night to pick up food. Where does that fit in your guidelines?
Yes. Well, that's something that is being allowed even in places where they have shut the cities down, and I don't foresee that changing as long as guidelines are followed, you know, and you're not having that close contact. I don't see an issue with that at all. It's being done in places like Los Angeles and New York yet. So, you know, as long as you're being safe, that's a safe activity. You just don't want to go as a group and get a bunch of food. Yeah.
Great. Thank you very much.
You bet. Mr. Shaw, any questions?
I do. Thank you. So thank you, Mary Rose, for the information and the work that you and your team are doing. The question I have, so we've had a number of people reach out who are expressing concern that they're not being given information regarding those who have tested positive for COVID-19. You had talked a little bit about the process that's administered by the VNA. So could you cover perhaps just what that process entails in terms of how they identify what exposure might exist? You know, what their contact process looks like for those that have been around individuals who have tested positive?
Sure. So this is Mary Rose Corrigan again. The contact has specific definitions, and I don't have those in front of me, but each individual that is worked with the VNA goes through a 16-page questionnaire about where they've been, who they were with, the time spent with them, for all of that information for days, and in some cases it could even be a week, depending on their exposure and when the test came out. So it is an in-depth kind of interview follow-up process. So that's for gathering the information, and includes getting specific names, if they're available, of people the person came in contact with, along with the situations. So for instance, if the case was at a specific work site, they would ask details about that work site, what they did, what kind of interaction they had with coworkers and or the public. And they would get specific information on the days that they worked, and a lot of details just on that. Then they would look at, of the results of those questions, you know, what people had significant time spent with that person within the 6-foot range. They would also take into account the symptoms of that person also. So they start with what we call the inner circle, and then they may go to the next one. So for instance, if the case was they spent a lot of time at one particular place, but on the way there, they also stopped at another place or did something with another group of people. They would, again, analyze that situation in terms of, you know, was it a public event? Was it a, you know, just a friend's house? And they would get contact information on that regarding that situation. So when the VNA follows up, if the person came into contact with a group of people and had close contact with them and they did not know their names or the specifics of those people, where they lived, etc., the VNA would reach out to that facility or organization or taxi cab service or whatever it was and do further contact tracing regarding that. They would say, you know, who was at this event or what here at this time of day, and you know what was happening, or do you have a list of people and can you help us reach them, those kinds of things. So at that point they may get assistance from organizations, employers, different things in notifying people and or getting their contact information and reaching them. And then the circle proceeds out based on Iowa Department of Public Health guidelines and the risks involved. So it is a pretty extensive process, and with that contact from the VNA, they are of course giving a lot of instructions, and you know, in a format that the contacts and the index case can totally understand, and providing that information to them, and guiding them on taking their temperature, when to seek health care, and those kinds of things. Does that help answer your question? And again, I may add that as this disease becomes more widespread, some of these guidelines may become more broad-based in terms of contact tracing.
Yeah, that helps, and if even just to dispel a rumor, I think that there's been discussion that the council knows they have this information, they're choosing not to release it. Just to state this, the HIPAA rules also apply to us. We have no clue who these individuals are. We don't have any of that information. And that's true with pretty well all but I would assume the VNA and then the medical staff that responded to that individual that initially sought medical attention. So, but yeah,
you're exactly right in terms of privacy, and we want to protect that privacy as much as possible for just a lot of different reasons. The person needs to recover. Their family members or friends may need to isolate. They don't need distractions and people acting negatively towards them or whatever. People who do follow up on communicable disease do get these names reported to them with their specific information. That part for the communicable disease investigation is not HIPAA protected. That allows the VNA to do those cases. I don't even get into the specifics of the information about these cases. It's strictly with them and the Iowa Department of Public Health.
Makes sense. Thank you very much. And thanks again for everything you're doing.
You're welcome.
Okay, Mr. Jones, do you have any questions?
I do not. Thank you.
Okay, Mr. Sprank, any questions?
I do not, but I just want to say thank you, Mary Rose, for all the work that you guys are doing, and keep doing what you're doing. Thank you.
Okay, and Ms. Roussel, any questions?
No questions. And thank you for sharing the website. I'm sure that will be very helpful for everyone to keep up to date.
All right, thank you.